therapeutics. Actually, this agent is Feridex, that is CPO. The commercial name is CPO, superparamagnetic iron oxide. This agent is colloidal suspension, consists of small clusters of iron containing molecule. It has a MO property to reduce T1 and as well as T2 and T2 star. Actually, this agent was developed for liver imaging and RES in 1990s. It became the commercially available agent after 2000. But finally, this agent was removed from market due to some serious side effect and lack of demonstrated clinical utility. Before starting my speak, I'd like to brief explanation for our physics. Actually, you can see brain imaging. This is T2 weighted imaging, and this is T1 weighted imaging. You can see CSF at the center of these images. If you see high signal intensity of CSF, it should be T2 weighted imaging. In contrast, this image shows low signal intensity of CSF and high signal intensity at the white matter of the brain. It should be T1 weighted imaging. Actually, after contrast agents injection, whatever it is based on the gadolinium or the iron oxide, there must be two effects. One is T1 shortening and the other one is T2 shortening. Even though they are shortening, both, but T1 shortening makes bright, higher signal intensity after injection of contrast agents, especially for gadolinium agents. You can see high signal intensity here. It is mainly because of gadolinium injection. And you can see darker signal intensity compared with superior imaging. It is because we made T2 acceleration on this study. Actually, T2 shortening means darker signal intensity on MR, the T2 weighted imaging. Please keep in mind these two terms, T1 shortening and T2 shortening, because it is a very important effect on for the explanation of contrast agents for the MR imaging. Okay, this study was reported 2005, about 10 years ago. At that time, this pure imaging was one of very fantastic contrast agents. These 4 images CT scanning, and these 3 images MR imaging after injection SPEO. You can see the heterogeneous enhancing region here and here. They are confirmed as metastasis from colon cancer. These images are from same patients with the metastasis of colon cancer, and you can see high signal intensity here and here and here. Actually, after injection of CPO, in the normal liver parenchyma has a large amount of Kupffer cells. They are kind of macrophages. Actually, macrophages have physiologic activities like the phagocytosis. Because of the phagocytosis, the CPO are spheres uptake by the liver cells. After that, because of T2 shortening, darker signal intensity on T1 T2 weighted imaging, the normal liver shows the darker signal intensity because of spire uptake in liver parenchyma. But in the tumor cells, like metastasis, has a very scanty amount of macrophages. Because of that, these metastatic lesions remained high signal intensity. The little uptake of SPEO uptake in these tumors. Because of that, the Feridex, the spire, was very popular during from the 2000 to about 2006. And then there are some researches where the researchers wanted to make the SPEO agents more popular than before in terms of vascular imaging. Actually, to obtain this pure enhanced MR imaging, we need 10 to 30 minutes to make the Cooper cells, the uptake, the spire, the agents. During these 1 to 30 minutes, we can make the other imaging sequences, kind of the MR angiography for the vascular imaging. Actually, the T2 agents also has T1 shortening effect. That is T1 high signal intensity after injection of contrast agents. In this study, the authors used the SPIO, the ion particle, for the T1 agents to then make blood vessels high signal intensity. You can see high signal intensity here and here is after injection SPIO and the USPO. USPO is a small, ultra small super paramagnetic iron oxide that is smaller agents than the SPIO. At this time, there are other studies that try to make the MR angiography using SPIO. You can see the three kinds of heart vascular imaging. This linear structure is the coronary artery. And after injection of gadolinium agents, the heart, the chambers, and the aorta here, and vascular structures, that is coronary artery, as I mentioned before. But there is also enhancement in the heart parenchyma. Because of this parenchymal enhancement, it is a little difficult to define coronary artery. But the iron oxide, such as SPIO, has less diffusion to the normal parenchyma. Because of that, you can see less enhancement in the heart myocardium of the SPIO agent. So we can clearly differentiate the heart myocardium and coronary artery. So in terms of vascular imaging, the iron oxide nanoparticle such as SPIO has two benefits. The Choi applied for the lymph node imaging because the USPO has lymphotropic characteristics. Actually, USPO is less lymph nodes, and but as similar 2003 on NEJM, it was amazing study. I think it makes the nanomedicine so popular at the time. After injection of USPO, you can see signal intensity change from white to dark. It is mainly because of USPO that is obtaken by macrophages in the lymph node, and this lymph node was confirmed normal. But this lymph node remains high signal intensity even after USPO injection, and this lymph node confirmed as the metastatic lymph node. And this imaging is interesting because after injection of USPO, you can see overall darkened signal intensity, but focal remained high signal intensity. It is suspicious, but this was metastatic foci. So in their report, the USPO has benefits to detect the lymph nodes with metastasis less than 5 millimeter in diameter. You can see the usual MR imaging cannot detect the metastasis less than 5 millimeter. But using USPO MRI, the authors report that more than the 40% worse could be detected after USPO application. But at the time, Professor Moon was studying in MGH. MGH group made this agent, so he brought the USPO with himself to Korea. So I could do some studies regarding USPO application for animal models. I compared with my colleagues in nuclear medicine the opacity with USPO imaging. You can see the less signal intensity change here, after USPO injection. So we could say that these two lymph nodes were metastatic. These two lymph nodes also show that the FDG uptake very highly. So pathology revealed also the metastatic lymph nodes. After injection of USPO, you can see dark signal intensity here. Before USPO, this region, this lymph nodes high signal intensity, but at the lower level of lymph nodes, you can see the less signal intensity change here. This region was not detected by PET-CT. Actually, this region was confirmed metastasis. Actually, in our study, also revealed that the metastatic foci less than 5 millimeter was could be diagnosed by using USPO MRI. And for the clinical application of iron nanoparticles, we have to consider the magnetic field. In the clinical scanner, there are two kinds of commonly used clinical scanners. One is 1.5 Tesla, the other one is 3 Tesla scanners. Actually, the higher scanner make the higher T2 effect or T2 star effect. It means that even though we use the same iron oxide or same contrast agent, we have to consider T1 and T2 effect. But actually, in our study, we proved that the higher, the darker signal intensity observed in 3 Tesla MR scanner compared with 1.5 Tesla MR scanner. Let's move on to the final decision of FDA for USPO. Even though their study was reported in NEJM, the Combidex, that is the commercial name of USPO in USA, and it was finally rejected by FDA because the FDA did not believe that the authors follow the federal regulation for the enrollment of patients, and there was several kinds of severe side effects, such as the hypersensitivity, and even one patient passed away because of very severe side effect, the anaphylaxis. So what we have to do for the iron nanoparticles for clinical applications. There are still many researchers who are modifying and developing new kinds of methods to make the iron oxide nanoparticles more biocompatible or feasible in human bodies. Actually, one of them is ferrimoxitol that is made by AMEC pharmaceutical company in US. Actually, these guys are very smart because ferrimoxitol was approved by the FDA, but not for MR contrast agents for anemia, the patients. Actually, anemia means loss of the RBC in human body. There are many anemia patients, especially the women with pregnancy. So the acute anemia can be corrected by injection of iron oxide, the iron materials. The ferrimoxitol was approved for that purpose. After that, they are trying to make this agent feasible in MR study. Actually, they made some research. You can see the high signal intensity region here, but after this region was obtained after ferrimoxitol injection, but still high signal intensity. As I mentioned before, it should be metastatic. It was confirmed by metastasis by pathology. So last year, actually, ferrimoxitol is one of the candidates for future wide range of clinical application. some researchers try to the further application for the vascular imaging. In this study, the authors try to make vascular imaging for pulmonary arterial embolism and even in brain vascular malformations. Actually, I think there are still potential to apply the ion nanoparticles to for a clinical application like these practice. In our group, we also modify the conjugates in the further development of use-pure agents. Recently, pegylation is one of good alternatives for the use-pure agents. And after injection of this agent, we could find the metastatic area like this. You can see high signal intensity in the metastatic foci and the target signal intensity in the normal lymph node. Okay, I'd like to move on to next issue, regarding gadolinium-based contrast agents. Recently, one of clinical issues regarding gadolinium-based contrast agents is NSF. What is NSF? Its full name is nephrogenic systemic fibrosis. It is extremely rare chronic progressive fibrosing disorder with rare visible cutaneous effects, which develops only in patients with clearly restricted renal function. It means that the abnormal renal function linked to injection of gadolinium-based contrast agents. Two combinations should be mentioned when we say that this patient has NSF. They include the abnormal renal function and the history of gadolinium-based contrast agents injection. In these patients, usually skin and subcutis marked thickened. It progresses from the extremities and body. The pathogenesis of NSF is not fully understood, but we believe that it is mainly because of the gadolinium agents and the dissociation of gadolinium from gadolinium chelate. The gadolinium has a potential of fibrogenic effect, and non-ionic linear gadolinium chelates can stimulate the proliferation of human fibroblasts. In terms of classification of gadolinium-based contrast agents, there are several methods, but most common classification is according to structures. They include microcyclic and open chain, linear. Open chain means linear agents. Usually, macrocyclic agents is more stable than the linear agents. So the stability means that dissociation of the gadolinium itself and the chelates. Actually, the non-ionic linear agents include Omniscan and Optimark seem to less stable than other kinds of the gadolinium-based contrast agents. These agents have the potential of make the NSF in patients with renal function impairment. The other issue is that gadolinium may remain in the brain. Actually, increased signal intensity in dentate nucleus and globus pallidus on non-enhanced T1 weighted MR images were reported, and they seem to be correlated positively with previous linear gadolinium agents exposure independent of renal function. Linear agents is more common than macrocyclic gadolinium agents. You can see high signal intensity. This patient has a history of multiple injection of gadolinium agents, even no injection for this study. You can see high signal intensity compared with a few months ago the imaging. You can see high signal. This area is dentate nucleus, but In patients with history of macrocyclic contrast agent injection, no signal intensity change here. So the other researcher in Japan measured the gadolinium agents concentration in vivo, I mean the ex vivo using caliber. His group found that the gadolinium agents accumulation in the brain, but still it is not clear what the accumulation in the brain of gadolinium agents make the problem or the neurodegeneration. It's not sure. Okay, because of these two issues, recently some research is using particles. We studied including vascular study. Actually, there are many ways to modify the nanoparticles. Magnetic nanoparticles can be used either, as I mentioned before, T1 and T2 agents, depending on their properties. Furthermore, MR contrast effect can be tuned by changing their core size, surface status, and composition and assembly of multiple nanoparticles. Usually, according to increase in nanoparticle size, the T2 effect increase, and instead the T1 effect decrease. But there are we need some rating for the size and the signal intensity. So we have to find what is optimal the size or modification for T1 and T2 imaging using nanoparticle. Actually, in this study, the authors found that the gadolinium, the authors compared the gadolinium agents and nanoparticle in terms of tumor imaging. You can see vascular structures on both images after injection of gadolinium agents and use-pure agents, respectively. You can see tumor enhancement here, but no tumor enhancement here. It means that the use-pure, the nanoparticle, has a tendency of less extravasation, less penetration of BBB, even in normal brain tissue and the brain tumors. So we can make more clear vascular imaging. That is not the leaky to normal brain tissue or tumor tissues. Okay, by modifying the MR imaging sequences, we can make T2 the T2 vascular images using the nanoparticles. In our group, we try to develop the optimal T1 agent based on the nanoparticle. You can see the magnetization of the nanoparticles according to magnetic field. The size of nanoparticles make the nanoparticles different in terms of magnetization according to magnetic field. The linear shape means that more similar to the gadolinium agents T1 as a T1 agent. You can see S shape here. It means that it is more paramagnetic. That means this character can be useful for the T2 agents. Actually, we modify the T1 agents. We believe that 3 millimeter nanoparticle is most suitable for T1 agent. So we obtain high resolution MR angiography like this. It was compared with the gadolinium agent, the MR imaging. Actually, it takes about 5 to 10 minutes to obtain these two images. the ion particle has two benefits, as I mentioned before: longer circulation time, and the other one is less leaky to the normal tissues. Because of these two reasons, we can make more clear the MR angiography like this. Okay, the other the property of MR imaging, the nanoparticles, is that we can use the nanoparticle for CT images. The tantalum oxide is one of these candidates, and we obtain the CT imaging after injection of tantalum oxide. And we also modified the composition of nanoparticles, the tantalum and iron and gold, as the previous speaker mentioned to us. Actually, we modified the tantalum oxide and the iron oxide to the dual modality for imaging in CT and MRI. You can see dark signal intensity here because of iron oxide effect, and the tantalum, because of tantalum oxide, we can visualize the vascular structures in mouse, the rat model. Okay, I will a little touch about the future clinical application of nanomedicine for therapeutics. Actually, the one of ion particle that is stereo nanoparticle has a potential of the prevention of the inflammation. Actually, in this study, my colleagues, they use stereo nanoparticle to prevent for the prevention of ischemic injury to brain. From this study, we developed next idea for fabrication of less the more the biocompatible biostent. The stereo nanoparticle was used to make less inflammation. You can see the macrophages, the infiltration of macrophages here. After stereo application, the macrophage of the infiltration there was less than this before the application of stereo. Actually, there are mainly two kinds of application of nanoparticles. One is in the systemic application by using intravenous injection. The other one is local treatment. Actually, we have plans to make these two applications for treatment. In this study, we used nanoparticles for the systemic delivery of the nano materials and the therapeutic agents. And for the local treatment, we use the laser, and for the PDT and PTT. Actually, in this study, we obtained the good result. The application of nanoparticles and PDT and PTT application makes the tumor treatment better than single application of the nanoparticle or the PDT only or PTT only. Okay, I'd like to summarize my talk. I think still the current nanotechnology promising and challenging. I think the imaging-based application for liver imaging, lymph node imaging, and vascular imaging were used commonly before, but it's time to make the other way to use the nanotechnology for clinical application. And I think the nanoparticle still has strength especially for therapeutic application. Thank you for your attention. They are my colleagues, and I have good collaborators, Taek Hwan-hyun and Tae-Hyung Kim in the engineering school in Seoul National University. Thank you for your attention.
Thank you. We have to thank you so much. think we can discuss during the lunchtime. So thanks, Dr. Choi again.